Good afternoon, everyone. My name is Justin Everett. I'm the Director of Marketing Communications for West, and I want to welcome you to today's webinar, Improving Patient Experience Through Routine Care Communication. I know there's a good number of people still logging into the session, a large crowd today, but we want to go ahead and get started and be respectful of the half hour you guys have blocked. So a couple of housekeeping things I'd like to address before we jump in. One, given those time constraints and the volume of participants in today's session, we won't do an open forum style of Q&A at the end, but what I anticipate and hope will happen is that you'll be able to key off of the content that we look at over the next half hour or so and figure out what questions you need to ask that are specific to your organization and how you approach routine care communication. So grab a pen and paper and write those down as they come up. Of course, you know your organization better than I do, so I'll ask that you to keep that in mind during the presentation, asking yourself, what would this mean for me if we want to add or even adjust some of these ideas around our patient outreach. Second point, even though we won't do a full Q&A at the end, I do encourage you to submit any questions that you have through the Q&A or chat functions that are on your screen. Go to webinar, we'll keep a log of those, and we'll be happy to follow up after the event and discuss with you. If you're not comfortable using the Q&A, that's fine too. The very last slide we'll see today will give you contact information to help you reach out and get more specific answers to your questions after the event. And then the third point, I get this every webinar we host, so I'll go ahead and mention now, we will plan to send a recording of the session as well as the PDF of the slides that we'll go through here, and hope to have it in your hands within the next 24 hours or so. So before we jump into the presentation, just wanted to take a moment to tell you a little bit about myself and my perspective on this topic. So I've just entered into my 10th year at West with a focus on our Televox solutions. And in my marketing role, a lot of these same concepts around message structure and channels that we're going to look at today, these are things that I'm able to leverage even in a B2B setting as I work with you guys. And also, what you'll hear here today is based on what we've seen from delivering millions of automated communications on behalf of healthcare organizations and even some of you guys that are on the call. A lot of what I mentioned today applies to automated notifications, whether it's phone calls, emails, or text messages. But even if you handle some of these same efforts manually, I think you'll still find some really good takeaways. So let's jump in. So our agenda today, we're just going to break this down into really four main parts. First, looking at why routine care communication improves patient experience. Second, the need for multiple outreach channels and achieving your goals around that. Third, how we structure our communication from a functionality standpoint and even just the content of those messages that make them patient-friendly and make it easy for patients to take action. We'll dive into some concepts around that. And then last, there's some benefits beyond the patient experience that you'll see if you'll start to focus more on the communication between visits, and we'll look at those as well. So where I wanted to start is sort of the why routine care communication leads to patient experience. So this was a survey of 200 C-suite executives from health leaders, and it covered both small, medium, and large hospitals. And 90% of those surveyed said that patient experience is at least among their top 5 priorities that are either already currently underway or they'll be launching within the next year. So 90% have revised patient and family communication strategies as a top priority. That's the fourth bar down on the screen there. And 33.5%, so pretty much a third, said it is the #1 top priority. So we look at the fourth bar down, 64% are already underway with revising their patient communication strategies. So 2/3 of you guys have committed to making some changes there, and that's great to see. And there's a similar focus on communication that's apparent in the 2015 healthcare survey from the ASQ, the American Society of Quality. And what they found was that 83% of those surveyed agreed that improved communication between patients and caregivers is a top priority for improving patient experience. So not a real big surprise there, right? But a great quote that came from their report on that was that patient experience is not just patient satisfaction. And I thought this was a good point that was made, that focus groups and surveys are not going to get you to a place of positive patient experience. It takes more than that. And just by way of your attendance in the event today and your interest in the topic and your registration, me speaking to you guys, I feel confident about two things. One, that you agree with that statement. The challenge of patient experience can't be solved with surveys alone. And then second, you're on the 2/3 from that last slide who've already figured out that improved patient communication has to be part of that solution. So when we think about the notion of improved communication, many of us are going to just naturally think about that face-to-face interaction between a patient and their provider. But what I want us to look at today are the touch points that are happening outside of the clinical setting, and how outreach for screenings and other routine care opportunities can drive patients to be more active in their care and ultimately improve their experience. So in general terms, more communication builds stronger provider-patient relationships. And of course, anyone can say that, right? So long as the communication is relevant to the patients, welcomed and not overdone, it just makes sense. But I want to support that statement with some recent patient-focused research. In a recent report called Technology Beyond the Exam Room, a survey of over 2,000 U.S. healthcare consumers uncovered two important relationship-related findings. The first one was communication in between visits fosters trust. So 30% of patients, of the 2,000 patients that were surveyed, said that receiving text messages, voicemails, or emails that provide care in between visits would increase feelings of trust in their provider. And another indicator of a strong relationship is this idea of feeling valued. And sure enough, 51%, so a little bit more than half of the consumers who receive that type of between-visit communication, reminders to schedule a screening, health tips, things like that, they say that they feel more valued. So talking about feeling valued and feeling trusted, I wanted to share this case study with you, and this was part of a project that we did with Scottsdale Medical Imaging, and I was fortunate enough to be involved in sort of the analysis and the results of it. And Scottsdale Medical Imaging works to target any patient who had ever been in for a mammogram and was at least 30 days past due for their next one, with a simple automated phone call to encourage them to schedule an appointment. And so what they found was that after sending out that communication, 20%, so 1 out of every 5, used the transfer option within that call to speak with staff about scheduling an appointment. And what it's meant is, it's just a really simple notification, but what it's meant for the practice is that it's sort of re-sparking the patient relationship, and they've found that it's made them more likely to return for other imaging needs beyond the simple routine mammogram. So a couple of quotes from the practice here. One was that our patients are so impressed that we're monitoring their health so closely, and we're building relationships with them for any of their future imaging needs. And even distilled down, quite simply, they're saying we're making patients for life. So I thought that was a pretty powerful thing to say, just coming out of a really simple notification around a routine mammogram, one of these routine care opportunities that we all have so many of. So making patients for life, that's a pretty lofty thing to say. That's a pretty incredible goal. So the question becomes, well, how do you create and revamp or adjust your routine care outreach strategies to lead you in that direction? What we'll go through over the next several slides is very tactical, I realize, but it's also very real in the how part of getting this done. So we'll start with the way you deliver between visit communications to patients. And the best recommendation I can make around message delivery is to consider using both multiple touches, so frequency, but also multiple channels. So here we're looking at both frequency and format. From the frequency aspect, we're at a point in 2016 where we're bombarded with marketing messages. In fact, it's 10 times what it was just a few decades ago. So just to put that in numbers for you, where the average person saw 300 marketing messages per day in the 1970s, that's up to 3,000 now. So what that means for all of us in terms of our outreach is that there's a lot more competition for our patients' attention. There's more clutter, there's more noise, And so a single touch doesn't have the impact it once did. So that kind of speaks to why you want to ramp up your frequency there, but varying formats is also really important. And if you're not doing it today, I recommend starting to capture patient preferences in how they want to receive communication from you. Because I can guarantee you it's not the same across the board, and I know you guys are already seeing that. Some patients prefer text, some prefer phone calls, some emails, etc. And there's a graphic on your screen here from that same Technology Beyond the Exam Room report I mentioned a slide or two back. And it's how consumers said that they prefer to receive various care-related messages. And there are a lot, I think about 9 or 10 different types of messages mentioned in the survey, but I pulled out ones I thought are really specific to routine care and wanted to show you here. So patient care between visits, 70% of the people who respond, 69% of the people who responded there said they prefer to hear about that through an automated channel. So the darker green there, that's a phone call from a healthcare professional. That's just someone on the staff. The other 3 channels there, an automated call, email, text, those are all automated channels. And 70% said care opportunities between visits, they prefer just to get an automated notification about that. And it's even stronger when you look at sort of healthy living tips or educational tips, and even seasonal reminders. So some of the times you can do with national health observances like National Breast Cancer Awareness Month, or even flu shots or something like that. People are preferring to receive that type of communication through an automated channel. So you can use that insight to come back and develop an outreach strategy that leans heavily on patient preferences, but still mixes in other communication channels. So we know we want to communicate by preference when possible, but we also know that we need to be more frequent and have more touches. So when you mix in some different channels here, you get to take advantage of kind of the cool aspects of every one of these. So just talking through these real quick. So voicemail or voice calls and IVR, that offers you patients a good opportunity to just immediately respond, and we'll talk about that in a minute, why that's so important. If you do mailed outreach, that's something that can be kind of kept and stored and put on a refrigerator or whatever it is, and it has a long shelf life for patients. A text message, so we've all seen the explosion of text, and we've certainly seen it from the West and Televox Solutions. And so text messaging has grown to have the highest user volume just on a transactional basis among the different communication channels, and that's kind of similar to mailed outreach in a way where it's really easy to store a text. So I mean, I rarely ever delete my text messages unless it's just my phone tells me I have to. So that's the kind of thing that when you get a text like that, you can just keep it on your phone and always go back and reference it. And email still has a strong play as well, because that continues to be the #1 activity of internet users. And a lot of people for a while were thinking that email was going to start to die off, but I think with the increased availability and access to it from our smartphones, it's been stronger than ever. So if you really start thinking bigger in terms of frequency and varying formats in your outreach, you can start to compete with those other 3,000 daily marketing messages that are being thrown at your patient. So I want to also spend some time on the content piece of this and how you structure messages and outreach that are going to make it easy and likely that your patients are going to respond positively. So first, let's look at the area of scripting. And here I want to get into message length, more specifically keeping your message to a manageable and digestible length for your patients. And a good rule of thumb is, if possible, try to keep any of your phone messages, so speaking about phones specifically here, try to keep any of those under 30 seconds. And so the question is why? Why keep it short? Well, just as kind of a lighthearted look at this, a Microsoft study from earlier this year found that a lot of us already suspected that the average human attention span is shrinking. It's gone from 12 seconds in 2000 to 8 seconds as of 2013, and that's of course not intended to suggest that we're less intelligent by any means. It's just that today's average consumer has so many more opportunities for distraction through those smartphones and through other new technology. So the best thing you can do in any effective communication, and this is what I was personally taught in Marketing 101, is get to the point. if you're trying to cut the length of a script for a phone message, for example, you go into that, quote, self-editor mode and take several passes through your scripting to remove any unnecessary words. So instead of something being very important, it's now just important. Instead of schedule an appointment as soon as possible, you can shorten that to schedule an appointment now or today. Really anything that shortens the script without pulling away from the meat of the message, that'll increase comprehension and attention from your patient. Another recommendation is to really zero in on your calls to action. And by call to action, I simply mean whatever it is that you're asking a patient to do in the outreach, whether that's calling a phone number, visiting a website, scheduling a screening. It needs to be extremely clear what you want them to do and then also how you want them to do it. Remember, the easier you can make it for patients to take action, the more likely they'll be to take those steps. So when we look at best practices around calls to action in your outreach, there are three things we want to make sure we cover. The first is immediacy. So whether they're reading a postcard or an email, listening to a phone message or whatever, it's important to get that call to action worked in early in the message. You're always going to have a certain portion of your targeted patients who abandon that message. That's just unavoidable. So getting the call to action in there in the beginning, you'll at least make sure they get that piece of it. The second around calls to action is repetition. So I like to call this the call to action sandwich. This is that idea of not only saying the call to action at the beginning of the message, but repeating that call to action again at the end to make sure you're really driving the point home. So you mentioned the call to action right up front, then maybe spend some time telling the patient why it's important, how the care opportunity relates to them, but then mention that call to action again. And the third part is equally important part is specificity, and this is the how of your call to action. This is where you lead the patient from get a screening to here's specifically how you get the screening scheduled. We can't rely on the message recipient to navigate through a website or look up a phone number to call. Let's be specific. And like we talked about on the last screen, just make it as easy as possible to take action. So a couple of examples that I put on your screen here, call us becomes call us at 888-123-4567, or visit us online becomes visit us online at abchealth.com/annual wellness visit. Be specific. And I've alluded to this a couple of times, but I think it's worth its own slide here. Another aspect of patient-friendly communication to think about as you're planning how you're going to connect is the idea of convenience. So check yourself along the way when you're in planning mode and ask yourself, am I making it easy for someone to respond and do what we're encouraging them to do? So let's walk through a couple of examples of how to make it easy for patients through the functionality that we can build into our outreach. So one of the most effective things you can do is allow patients to transfer from an automated call. So they answer the call, they hear the message, and then press 1 or 2 or whatever on their phone keypad to connect with the staff and schedule their appointment. From the patient's point of view, this really couldn't be easier. There's no need to write down a number to call later or anything like that that would require extra effort. Just press the phone keypad and take care of the scheduling. From your perspective, adding in a call transfer, I like to say it helps you strike while the iron's hot, so to speak. So your communication tells the patient why it's important, and then they can book their appointment right then while it's top of mind, rather than taking the chance that they'll get distracted at a later point and ultimately never take action. One point to note when we talk about call transfers, and this is a question we get a lot, is that outbound communication can be delivered at a volume that's comfortable for the scheduling staff on an inbound basis. So if you're worried that you could potentially have too many people transfer back in, you can adjust that or throttle the number of communications happening at any point so that team never gets overwhelmed and that it's pacing it at a comfortable level. Another example of making it easy is in a text message. Formatting allows you to have the scheduling phone number in the text where patients can simply press the number and initiate the call. So it's sometimes that's called tap to call. So there's no need to key in a number. It literally takes one touch of the finger. This is super easy, right? And then, of course, after an appointment's scheduled, if you were reminding patients of the appointment through a text message, you can have the date and time formatted to where it's easy to tap that and then have it added to the patient's calendar. Even pre-registration notifications have a similar built-in convenience factor where a text or email notification can link out to a URL where patients complete that information ahead of their appointment. We talked about keeping messages short and to the point. We talked about clear calls to action. We also talked about making it as easy as possible to take action. But the contribution to improve patient experience, it can go beyond the message itself by exposing patients to additional helpful resources. So your portal, I think, is a great example here. So within a communication about a screening or some other routine care opportunity, you can include language to remind patients of the portal and how they can use it to make online payments, retrieve lab results, view educational content, whatever is there and available to them. As of 2014, only 23% of patients had enrolled in their provider's portal. So there's a big opportunity to promote that and make sure that the patients are taking full advantage of the resources that you're offering them, because I think that's a big part of the patient experience. If you have educational content within the portal that ties into a particular screening or a wellness topic that your core message, your core communication is about, then that's a perfect segue and a perfect thing to mention here for the patient's benefit. So at the beginning of the session, and I know we're starting to run short on time, but I want to revisit a couple of things. So we talked about some additional benefits to your organization that go beyond patient experience. And a great example of that is revenue generation. So if we revisit the Scottsdale Medical Imaging case study from earlier, they've been able to move toward that notion of making patients for life, if you remember that quote. But there's also been a huge impact in terms of appointment volume. They were targeting patients who were at least 30 days past due for their mammogram. And for this practice, that meant an average of 500 patients receiving the communication each month. So the 20% appointment booking rate, remember that's people who were listening to the message and then pressing the keypad to transfer and schedule, 20% appointment booking rate, it meant they were able to schedule an additional 1,200 mammograms annually, which the practice then estimated generated nearly $250,000 on an annual basis. So you can see the focus on routine care outreach. It has positive implications beyond just improving patient experience. And I'll share another example. Let's look at a second case study to expand on that even further. So we've worked with Ochsner Health System in New Orleans on a project that targeted roughly 3,100 patients in need of a colonoscopy or an upper endoscopy. Patients received an automated phone call encouraging them to schedule that exam, so very similar to what happened with Scottsdale Medical Imaging. And there were significant positive results in 4 different areas. So first, on the upper left of the screen of the 4 below, the staff shared great feedback on the project in terms of patient experience. So what they told us is that patients have expressed appreciation for the West outreach, and many have told our team if they were not nudged or reminded, they would not have completed this important test. So another pretty powerful quote from a patient experience sense. From an operational perspective, it allowed the Ochsner team to cover ground and deliver outreach they never could have managed otherwise. And I'll read you that quote as well. So they told us, because West handles the outbound communication, my team of 8 FTEs can manage incoming response for scheduling and other questions. Delivering a similar campaign with manual resources would have required a 30-person call center. So certainly a major operational impact there. And while those 2 areas are great to hear, they still don't show that the project was effective from the patient standpoint in terms of driving appointments and improving outcomes. That comes in through the conversion rates from the outreach. So 18% of the patients who received the call scheduled their exam. And based on a national average of 25% precancerous polyp detection, it's estimated that approximately 145 actually benefited from early detection in this target group of 3,100. And like the Scottsdale case study, the revenue bump for Ochsner was also very significant. So there's the 18% conversion from that 37 who were targeted meant that 578 patients scheduled an exam at nearly $1,200 in revenue for each exam. An outreach campaign that costs literally pennies per patient, that is super minimal investment there, it generated over $684,000. So while we focus on the ability of the routine care communication to positively impact patient experience, there's definitely those other important benefits that come along with that focus. So we've just got a couple of minutes here, but I did want to quickly review. A half an hour kind of flies by, but I wanted to come back to what we hope to cover today and see where we're at. So first we wanted to look at why routine care communication improves patient experience. And I tried to just put some really key high-level takeaways to drive these home. And to that first one, I would just say patients have told us, that survey of 2,000 U.S. healthcare consumers have told us that it does two very important relationship-building things. It increases feelings of trust in their caregivers, and it also makes patients feel more valued. Like the patients at Scottsdale Medical Imaging said, they're making patients for life. There's that sense of I trust my provider and I feel valued. Second, there's that need for multiple outreach channels just to make sure we're breaking through the noise. And you can do that by increasing both frequency, the number of times you reach out to your patients, and to just avoid becoming redundant there, mix in the channels, different channels, whether it's phone calls, emails, texts, and take advantage of all the different advantages that those individual outreach media offer. Third was patient-friendly message structure and functionality. So we had several key concepts we went through there. One, the idea that less is more. Be short, be to the point with your message. Focus on calls to action. That's very important. So to be both, or kind of three tiers to that: be immediate, be specific, and make sure that it's easy for patients to know what they need to do and how they need to do it. And then the third part was making it easy. So anything you can build into your communication, whether it's pressing a button to call transfer or in a text message, having that phone number just be a simple one-press tap to call, so they don't have to key in the phone number. Super important from a convenience standpoint. And then also another element of message structure that can lead to improved patient experience, I think, is that opportunity to expose patients to additional helpful resources, driving them to the portal or whatever it is that can help them make the most of what you offer them from an educational and just a service standpoint. And then we also made sure we looked at those benefits that go beyond the patient experience. And the two big ones there are greater continuity of care, because you're engaging patients more between visits, and what you'll find is that there's really an opportunity to generate additional revenue along with that. So with those points in mind, wanted to thank you for the attendance today and share the contact information that I promised at the beginning of the webinar. So any questions you have that you're not comfortable submitting through the Q&A, please do go ahead and send those to healthcareideas@west.com, or call us at 800-644-4266. And if you are currently a client of ours and have some questions, and you can provide your customer number, that's always very helpful in our follow-up. But again, I wanted to thank you for your attendance today. I hope you had some good takeaways there. And again, we'll plan to share a recording and the slide deck with you, hopefully within the next 24 hours or so. So thank you again for your attendance, and this concludes the webinar. Have a great afternoon.